I got my MRI results this morning, and I haven't talked to a doctor. I haven't completed my blood work, so this isn't like a diagnosis, but. So I'm here. I am in front of the building that I will be getting my MRI enterography, and I just kind of wanted to chit chat a little bit because I am going into this test a little anxious, and I think the anxiety honestly is just from everything that I've been through. I'm not necessarily thinking that um I'm not thinking the worst here, but I am worried about the unknown. I don't know what's going to come of this test, and I'm trying to remain hopeful and positive that whatever does come from this will lead to more answers and hopefully more ability to take control of my health, because ultimately that's what matters most. And maybe it'll be a kick in the butt of some sort to really get control of what's going on with my body, or give me some kind of blueprint maybe to help along the way. But so an MRI enterography, I'll be doing prep while I'm there, so I have to drink the contrast, and I'll be getting an IV, and the prep I think takes like an hour and a half, and that's after I have to register and all that. So I'm about like an hour, I'm almost 2 hours early for the test, or an hour and a half early, and then they have to do the actual MRI. So, and I will say, this sounds kind of like counterintuitive, but I'm not upset about getting a scan, because I feel like, you always are a little nervous about some kind of recurrence no matter what your situation. And if they do an MRI, maybe they would catch something on there if that was not so good. But I did just have that ctDNA test, so I'm not really thinking along those lines too much, but that's always in the back of my mind when having a scan. After the negative result, it makes you feel a little bit more safe. I don't know. It's like the comfort of having a clean scan for a little while. Just a little bit of a backstory as to like how I ended up to get this MRI, or this MRE, was because my mother had colon cancer, and because of that, when you have a parent that has colon cancer, you usually do testing or preventative testing earlier, so you have a greater chance of getting colon cancer. And given my medical history, I don't want to skip any of that stuff. So I scheduled it just as preventative measures, but colon looked good during the colonoscopy, though she did see some inflammation within the small bowel. So because of that, she's worried about Crohn's disease, and I have so many questions about that because of my circumstance, what I've been through, and what my gut has been through. And because AC for breast cancer, AC chemo, is really harsh on the gut. And then not only that, I was pregnant, and we all know that the increase of progesterone can really jack up your GI, or everything from pregnancy could jack everything up, to be honest. But so add chemo, pregnancy, and then after that, starting more medications that alter my hormones and all that, and then starting another medication, Verzenio, which is it's like an oral chemo, but it's a CDK4 and 6 inhibitor, but it's also really known to disrupt your GI. It causes a lot of women, massive issues, of going to the bathroom. And luckily I didn't really have that, but I will say that my stomach hasn't really been right since I was diagnosed. Like throughout treatment, after treatment, it just wasn't the same. It wasn't normal, but it wasn't terrible either. So I didn't really think there was an issue at all. So I was a little surprised, I guess, but I actually take that back. I have noticed I've been bloated, more often, but I don't know. I kind of always just like assume it is from my medication because of the things I'm taking. So I'd brushed it off, I guess, which I probably shouldn't have, but yeah, so that was something I noticed as well. So had this, she said my small bowel looks inflamed. I asked her about Verzenio. I asked her about my history, and she didn't really seem like that would be like how we just assume that's what it's from. She wants to do more testing, so that's why I'm here. I'll also be getting blood work. I'll also be getting a stool sample, which is super exciting. I haven't done the blood work yet. I'm gonna do that later this week. I have to work around my husband's schedule because of the kids and figure out a way to manage that. So my doctor, my GI, who's awesome, she said she spoke to my oncologist. I haven't heard from her since, so I'm sure we'll talk about that once we have the results of this MRI enterography. And she did say that if this wasn't showing Crohn's, if this MRI doesn't show, or MRE doesn't show Crohn's, that she'll probably want to do another colonoscopy. And while it wasn't terrible, the colonoscopy itself wasn't terrible. I don't think people who haven't done it yet realize like kind of like the focus you need to do a colonoscopy. Like, I'm really glad I wasn't working, and I'm really glad that I'm glad I was available to be home, and I was able to get support because my husband was off work, so he was able to take care of the kids when I was not feeling well, because it started off easy, and then as the prep, I had an easy prep too apparently, but as the prep went on, I started to feel not so great, and I was exhausted. I had a headache, and honestly, I just didn't enjoy it. And then getting put to sleep was nice, but even then afterwards, my stomach just felt off after that, and I wasn't feeling well. It took me like a day or 2 or 3 to recover, it felt like, from my stomach. And so it was like a little less than a week where I felt like it affected me. So I'm not really looking forward to doing that again. But I'm hoping that with this comes answers and allows me the ability to move forward and feel better and make the right choices or better choices, or I'm trying to remain hopeful. And I do want to just say, like, stuff like this could really throw people who have a medical history, a long list, kind of like into a little spiral, because I have noticed myself thinking a lot about where I was throughout my whole like cancer situation a lot today, and remembering like feelings and that feeling of something just looming over your head. And that's normal, and I keep telling myself that, at least, that this is normal. I'm going into something that's unknown. I don't really know what's going to happen. I've felt this way before, and obviously I was going through something that was terrible, and so I can get some of those feelings, and it's normal, and it doesn't mean it's going to stay here. So just going to breathe on that one. And it's okay to be irritated. It's okay to be irritated, to have to continue to kind of figure out your situation and feel like it's just like your health is just not good. And granted, I'd rather much, I don't know, like, I'm glad I'm not where I was, and that is something I'm grateful for, but that doesn't mean that I'm not bothered, or not scared of what's next. But I know that whatever happens, I'll be able to tackle it, and that's the mindset I need to keep in, because if I don't, I could see myself kind of getting into that negative mindset that I don't want to be. That's only going to make it harder. So I'm just trying to keep it cool, keep it casual, and I look forward to getting the results, and I look forward to doing what I need to do to get beyond this. Welcome to my backyard. I am watching my children play with dirt. As long as they're happy, I'm sorry for the camera angle, how I look, all of the above. I got my MRI results this morning, and I haven't talked to a doctor. I haven't completed my blood work, so this isn't like a diagnosis, but the MRI said it was consistent with chronic, disease state, and stated it was clinically, it clinically looked like Crohn's disease. So it's like, what the front door, you know what I mean? I'm just frustrated. It feels like it's frustrating, and I'm hoping somehow something good will come of this. I laugh because it's just like crazy. I don't want to take medication. Again, I haven't talked to the doctor, so this is all me like assuming, but she did mention that like if it was Crohn's, there's like talk of like what medications I'll have to take and stuff, and I'm not gonna do that. I'd rather try like to fix whatever is going on with my diet, but I also I have some tools. I don't have all the tools, especially in regards to Crohn's specifically, so I'm gonna have to find somebody that knows the fuck they're talking about. Excuse my language. I just feel kind of like meh today, I feel like the wind was taken out of me, and I'm just frustrated, and I'm just allowing myself that space today to be frustrated and kind of, accept what's going on, and tomorrow I'll move on from it, Yeah, so I'll probably try to do that blood work today now that I have the MRI results, and hopefully talk to my doctor sooner rather than later, or maybe she'll call me today, who knows, hopefully. And I have a follow-up with my oncologist, which I'd really like to talk to him about this. And I also have a cyst on my liver, which makes me severely uncomfortable. I'm just gonna leave it at that.